I would like to show you a basic yoga sequence for back pain. Now, oftentimes when a person has back pain, they get nervous or scared, or perhaps they've been advised to simply take it easy or rest. But we have found that mobility or movement is very important for back pain. It is one of the best things to treat it, actually. Now, of course, if your back pain is very intense, where it's sharp and shooting, or it's causing numbness and tingling down your leg, it is crucial that you contact your physical therapist first. Okay, now the sequence that I want to show you contains 5 different poses, and a lot of it is focused on breathing. So we're just going to go ahead and get started. I'm going to demonstrate the exercise, and then we're going to do 5 repetitions of each. If at any time your back pain is elevating or this is making it worse, then don't do the movement and just concentrate on breathing. Okay, so let's get started. The first exercise is legs up the wall. So I'm going to have you scoot your bottom close to a wall and put your feet up on there so that your knees and your hips are at about a 90-degree angle. Hands can be, actually, let's put them on our rib cage here. What I want you to do first is focus on breathing. So when we breathe, we want to breathe nice and deep. So with your hands on your rib cage, I want you to take a breath in through your nose and really try to feel your entire rib cage expand. So let's go ahead and do one breath together. Go ahead and inhale. And then exhale out of your mouth. When you inhale, like I said, the rib cage is going to expand in all different directions. And upon your exhale, you should feel your rib cage kind of closing down, coming closer to your pubic bone, and feeling your core engage. The other thing we can do to get a better core activation is to press your feet gently into the wall upon your exhale. Okay, so let's go ahead and let's do 5 together. Very good. I hope you noticed that if you did feel strain or stress in your neck, you tried to relax that a little bit. It is really common to carry stress and tension up in our neck or shoulders, and when we breathe, we often breathe through that part of our body. So when you're doing that breathing exercise, it's really concentrate on getting that rib cage to expand. Okay, so the second exercise, we're going to go ahead and scoot your bottom back a little bit. And what I want you to do, this is kind of 2 parts, depending on how your back feels. We're going to move with our breath, and I'm going to have you put your hands on the floor. You're going to inhale first, and then on your exhale, you're going to tip your pelvis back towards the mat. And then you can inhale and release it. Now moving within the range of motion, I guess, that feels good for your back is what we want you to do. So if that is all good and you want to take it a step further, you can inhale, and then on your exhale, you're going to scoop up and up into a bridge. Okay, so let's go ahead and do 5 of these together. You choose. You either stay rocking back and forth with your breath, or you lift your bottom up. I'm going to do the bridge version. So arms at your side. Nice deep inhale. Good. Okay, so when you're not accustomed to it, moving with your breath can be tricky. So that is your goal, to try to flow one movement, one breath. But certainly do not hold your breath, and if you need to take a couple more breaths in between, that's okay. All right, so I'm gonna have you scooch to the side of your mat, and you're gonna log roll over to your side using your hands to push you back up. That is also the best way to get up out of bed in the morning when your back may or may not be hurting, okay? So let's move into all fours position. So you're gonna be on your hands and knees, and I want you to be mindful that your wrists are right underneath your shoulders and your knees are right underneath your hips. From here, again, we're gonna flow with our breath. And we're gonna do something called cat and cow or cat and camel. So what I want you to do first is you're gonna inhale, and when you inhale, you look up and you drop your belly down, arching your lower back. On your exhale, you're going to look down, lifting through your back, kind of looking towards your belly button. Okay, so we're gonna do 5 of those together. Let's go ahead and start with our inhale. Very good. Now, when you did cat and cow or cat and camel, you were able to move your body as far as it could go comfortably. So respect that. You want it to be comfortable. So what I'd like you to do next is I want you to try to find neutral spine, which means it's not all the way rounded or all the way arched. It's halfway in between. It's also known as tabletop. So once you're in that tabletop position, I want you to focus on contracting your inner core. So that's a whole nother video. The inner core is quite complex, but we're gonna simplify it here. And what I want you to do is you're gonna inhale, staying in that neutral spine, and on your exhale, you're just gonna try to pull in your lower tummy muscles, the sides of your waist, and your pelvic floor, and hold, and then release on the inhale, okay? So it's going to not look like a whole lot when I'm doing it. But what's going to happen is it's an inhale and then an exhale. So a lot is happening when I exhale, okay? I am pulling up my pelvic floor. A friend of mine is a pelvic core specialist, a physical therapist that specializes in that. And she talks about how important the pelvic floor is. So just a little tidbit. When you exhale, if you're a female, I want you to try to close the openings of your pelvic floor or draw it up and in. And same thing for a male, you're going to try to draw your pelvic floor up and in, or like my friend says, try to get the turtle into the shell, okay? So then your exhale is drawing up pelvic floor, pulling in the sides of your waist, and really using your rib cage to breathe or kind of compress it down when you exhale. All right, let's go through 5 breaths in that tabletop position. Okay, so if you felt comfortable with the all fours tabletop position and the breathing and engagement of your core, you can take it one step further into something called spinal balance. Some people call it bird dog. So I'll go ahead and show that for you, and we'll do a few of them together. Okay, so we're gonna come back into that tabletop position, and you're gonna move with your breath. So as you inhale, well, first you take a nice deep inhale, then as you exhale, you move your opposite arm and leg. And you repeat back and forth. Now this exercise is really easy to modify. You can start just by sliding your leg and keeping it in contact with the ground rather than picking it up. So the key here is to maintain the stability in your spine and not be wiggling all over the place. All right, let's go ahead and do 5 together. Nice deep inhale first. Good. Now, I'm not sure if you could hear it or not, but my joints like to crack a lot when I do that, and I have been spending a lot of time sitting today. So as long as those cracks aren't painful, it's okay. All right, so the last exercise that we're going to do is child's pose. Now, there's a couple of variations to make this comfortable as well. The classic child's pose is just your knees kind of separated, and then coming forward, resting, like reaching with your arms and resting your head straight down. Now, if that seems difficult for you and you can't get into that position, you can use a yoga block or a pillow. I can just put a yoga block in whatever position is comfortable, like right underneath my butt. And then come down maybe to my elbows. You could also stack your hands like this and just rest. When you find that comfortable position that feels good, the goal with this is to take some nice deep breaths. And if you can direct your inhale towards the part of your body that maybe is hurting, it can help relax it too. So just recognize how much tension you might be holding in the muscles in that area and try to release them. I would stay here for at least 5 breaths, maybe even 10. Just take the time and do whatever your body needs. Great, I hope this helps you. And if you have any further questions or any concerns, or perhaps your back pain is kind of encroaching into that area of sharp pain or numbness and tingling, you can always find me at juniperpt.com. I'm on Facebook as well. It's facebook.com/juniperpt. Feel free to message me there or reach out to me via email, elizabeth@juniperpt.com. Thank you.